Alaikum. I'm Dr. Tahira and you're watching program Health is Wealth. We just finished Eid and spring is here. We have a lot of celebrations going on. And during celebrations, what happens is we overeat. And all this overeating and non-compliance of medication is what leads to so many problems, including diabetes, allergies, and what's not. That is why in today's episode, we will be discussing in detail all that you need to know about diabetes, allergies, and everything else. Assalamu alaikum. Welcome to another episode of Health is Wealth. We're back from Ramadan and we've been doing so much of overeating. We've been eating everything, not just sweets, but all kind of fried products, all kind of refined carbs and everything that we could get our hands on. And that is why we have so many complications post-Ramadan, because we don't understand the essence of fasting. Rather, we convert it to something where we start overeating and we start, we leave the compliance of our medicines. So today we are going to discuss in detail all those issues with uncontrolled diabetes and how we let it go. And for this discussion today, we have our esteemed guest. We have Dr. Usman. Zafar, thank you so much. He's an associate professor of internal medicine. We will be discussing in detail diabetes, its complications, and its management with him, along with other metabolic disorders as well. Thank you so much for joining us today.
Thank you.
First things first, what will you say about people who have been really overeating this Ramadan, especially diabetics, and not those who were not diabetics but have ended up having diabetes, and how they should go about it?
Yes, I think the essence of Ramadan is fasting, but we turn it into feasting.
Exactly.
And that is what actually which takes a toll on our health as well. And in Ramadan especially, the type of food which we eat or which we prefer, they are usually rich in carbohydrates as well as fats.
Right.
We're eating samosas and pakoras and all these things.
We think it is, compulsory.
Yes. And the other thing is, which is actually out of our religion, that majority of the people, and majority of my patients at least, they prefer fasting.
Right.
And while they are diabetics, even when they are advised against it, they prefer to fast. And while people are fasting in Ramadan, it becomes very difficult sometimes to control their blood sugars, because the routine becomes very odd in a sense, because they are eating for 4 to 5 hours, and they are not eating for 16 hours.
Right.
So sometimes the sugars become really out of hand, and people start missing their tablets as well, because managing glucose with routine tablet schedule or insulin schedule becomes very difficult.
Right.
So they become non-compliant, and after Ramadan when they come to us, and then there are many issues of non-compliance and poor control, and then again a new routine has to be set for them.
Why do you think so many people have diabetes nowadays? In the olden days, in our parents' times, not many people had diabetes. Either they didn't have it or they were not diagnosed. Is it the processed diet? Is it the refined carbs, lack of exercise? What would you attribute to the increased incidence of diabetes nowadays?
I think it is because of the change in lifestyle which has occurred over the past 5 to 6 decades. Less physical activity, availability of food, availability of ready-to-eat food, the incoming of refrigerators on one hand, and then the availability of pre-cooked, ready-to-eat meals, packaged foods.
Right.
So all these things have actually contributed their part in this epidemic of diabetes, which I should say.
Right. How do you diagnose diabetes? What are the symptoms that you should, if you are, they say it's when you feel very thirsty, if you have to go to the washroom a lot, if you're feeling tired. What else are the symptoms one should look for in diabetes? And also, while you are discussing this, please mention the 2 types of diabetes: the type 1 juvenile and the type 2, so that they know the difference.
Yes, in Pakistan is one of those countries which are, on top in terms of prevalence of diabetes. Every 4th person above the age of 20 years is diabetic in Pakistan. Every 4th adult above the age of 20 years. And this is probably the highest prevalence worldwide. People present to us with different presentations. Majority of the people which come to us usually tell us that they are losing weight without any reason, so a weight loss.
Right.
Secondly, the symptoms you mentioned of polyuria,
Polydips, yeah.
yes, frequent micturition, and feeling thirsty all the time, feeling of dry mouth.
Okay.
Sometimes people come to us with extreme fatigue out of no reason. And we investigate them, they go for a test and they are found to be a newly diagnosed diabetic.
What about infections that don't heal, like
Yes,
repeatedly
yes,
having infections like yeast infections?
Sometimes
and
people
all
come
of
to
that?
us with complications, like they present with burning feet.
Exactly.
And when they are investigated, it is found out that they are
Neuropathy,
diabetic.
yeah.
And this process of diabetes actually starts years and years before the actual diagnosis is made. And sometimes people present with complications of diabetes even before a diagnosis of diabetes itself is made.
Exactly.
So they present with
So
complications.
when we were talking about the types of diabetes, type 1 juvenile diabetes and the other one is adult onset. You said in Pakistan the adult onset one is more common, right?
Yes.
So what is the reason for this and how do you know that this is juvenile and this is adult onset? What is the difference in the mechanism?
Yes, actually this classification of juvenile and adult onset is rather changed now.
Oh, it is.
And they are called type 1 and type 2.
Type 2.
Initially it was thought that it's type 1 diabetes which occurs in the childhood.
Yeah.
But now we know that incidence of type 1 diabetes actually remains the same throughout 6 decades of life.
Okay.
But this incidence, small incidence of type 2 diabetes sinks into the larger incidence of type 2 diabetes which occurs as the age of the people grows. So it is lack of identification of type 1 diabetes in the later ages,
Right.
which is responsible for labeling it as a juvenile diabetes. Actually its incidence remains the same, but the type 2 diabetes occurs usually with advancing age, development of obesity, poor physical activity, overeating, and all these things.
So you mentioned that when we have type 1 diabetes or the juvenile onset that we call it before, what happens is we start losing weight because we are not having enough of insulin production from the pancreas, right? But in the type 2, the insulin is being produced, but it is insulin resistant. Our body gets insulin resistant, so we have obesity, especially this mid-truncal and everything. Could you tell what exactly is insulin resistance? Because that is so prevalent nowadays. People have metabolic syndrome. Some women have PCOS, PCOD as well, along with insulin resistance. And insulin resistance is causing all the other issues as well. So what exactly is insulin resistance and how is it different from diabetes?
Yes, type 1 occurs when there is absolute deficiency of insulin. Okay. Insulin is synthesized in pancreas, and in type 1 diabetes there is autoimmune or the body's own initiated destruction of the cells which produce insulin in the body. And there is absolute deficiency. In type 2 diabetes, which is the more prevalent one, actually more than 95% of diabetes which is prevalent in our country and the worldwide is type 2. And in this case, it is obesity and lack of physical activity which is leading to reduced action of insulin on the cells. And when insulin is not able to act on the cells, body initially tries to produce more insulin, and ultimately a stage comes when the insulin producing cells are fatigued and they, out of their overwork, they start dying, which the process is called apoptosis. And that is the time when type 2 diabetes is diagnosed. And it is not only diabetes which is part of this, I must say, must say syndrome, but also cardiac disease, ischemic heart disease, stroke, neuropathies, kidney disease, eye disease. So all these things which are labeled as complications of diabetes, they occur in this process.
So when we need to test for diabetes, right, we have these random tests, and then we have the fasting one, random blood sugar, fasting blood sugar, and HbA1c. So which test is most reliable? And when we talk about random and fasting, what is the exact time for us to monitor it? And what are the values? So that everybody watching right now clearly knows that this is how much their HbA1c should be. That's from the lab. And when they do it at home, this is how much it should be, and this is what they should aim for.
Yes, there are mainly 3 tests which are used for diagnosis of diabetes. One is fasting blood sugar, and this fasting should be an overnight fast. Overnight fast of at least 8 to 10 hours, and in the morning we test blood sugar, and any blood sugar level which is above 125, 126 and above is considered to be diabetes. but a single test is not enough. We repeat this test after a few days, or we go for another test. If two consecutive tests are positive, then we label the patient as having diabetes mellitus. The other test is HbA1c, and the cutoff for diabetes is anything above 6.4. So 6.5 and above is considered to be diabetes. And the third test is glucose tolerance test, in which we give patients a glucose solution, and after drinking that glucose solution, we check sugar levels after 2 hours. And if the blood sugar levels after 2 hours are above 200, then we diagnose the patient as having diabetes. But I would say that even before these cutoffs are reached, there is another stage which is called pre-diabetes or borderline diabetes, when the patient is not has not actually crossed these thresholds, but still he is at a very high risk of developing diabetes, and some of the complications of diabetes even start occurring at this stage of pre-diabetes. So what we should aim for is normal glucose levels, not pre-diabetes. Even pre-diabetes is dangerous.
So when we talk about pre-diabetes or borderline diabetes, do we start medication or lifestyle modification is enough? And when we speak of lifestyle modification, please could you explain it to everybody how important it is to refrain from eating certain items, to have a certain lifestyle in eating, as well as an exercise, as well as a cessation of smoking and all that. First, we'll talk about lifestyle modification and later on the drugs.
Yes. I would say actually it's a lifestyle modification should not even be there in pre-diabetes, but it should be there for everybody. Because whosoever has actually a weight which is more than normal is at a risk of developing diabetes, obesity. Anybody who's obese, anybody who is not having enough of exercise daily, he is at a risk of developing diabetes sooner or later. So lifestyle modification should be part of our plan, our strategy for everybody, right from the school level, right from the youngsters. We should tell them that you have to be physically active. What physical activity regimen we prescribe is for adults is that one should go for 30 to 40 minutes. We recommend patients and everybody else as well that they should do at least 30 to 40 minutes of moderate intensity physical activity daily. And this moderate intensity actually varies for different people. For young people, it is jogging, doing some push-ups, sit-ups, chin-ups, other exercises. And for elderly, it can be a very quick or brisk walk. But the problem is that is our social context when we talk about exercise to the youngsters. So they think that walking is enough for them. Walking is not enough for them. They should be running. And it's the elderly or the people above the age of 60 which should be walking. So this is something which we need to understand. Secondly, remaining physically active throughout the day. It is also very important. Some people go for 10,000 steps a day, which is a very good idea. Some people will avoid going on motorcycle or car, and they will try to walk towards their workplace or towards the school or to the market. So that's a good idea. So we should inculcate habits which can increase our routine physical activity in our routine life. So that is very important. And that is also another point is that it is also for the females as well. Many of the females are housewives. They usually think that whatever house chores they are doing at home is enough for them. It is not enough for them. They have to go for specific exercise regimen daily. They need exercise as the males need exercise. So it is important for them to be physically active, because in my practice, I am seeing a lot of females which are developing diabetes, and they are developing diabetes earlier than the males. So that is a bad thing.
What about gestational diabetes? How important is that, and why is it so prevalent, and what are the complications that can arise out of uncontrolled diabetes during pregnancy, leading to large fatigues baby and problems for the mother and the child?
Yes, gestational diabetes is another thing. In some ways, it is also related to those risk factors which are there for type 2 diabetes, that is poor physical activity and being overweight. The main reason behind it is the hormones which are produced during pregnancy, and these hormones can cause dysregulation of glucose levels in the body, and the female can develop diabetes, higher glucose levels, and this diabetes becomes a risk factor for the child. The children can become larger in size, and the and the female which is going to deliver normally otherwise can need C-section.
Right.
Secondly, there can be certain complications post delivery to the baby as well as to the mother. So usually our gynecologists, when females go for their antenatals, they do check them for gestational diabetes mellitus. Usually it occurs after 24th week of gestation, and if they are having gestational diabetes mellitus, then it should be managed not only with medication but also with lifestyle modification during pregnancy.
When we speak about medications, we have a various options, right? You said for type 1, okay, we have insulin, then we have different kinds of insulin, short acting, long acting, and all of that. And how do we use insulin? What are the precautions while using it? Because some people, don't take enough food after insulin and then they have hypoglycemic attacks and all of that. First, let's talk about insulin, then we'll come to the other glucose inhibitors.
I think as far as the treatment regimen is concerned, it has to be individualized.
Okay.
There is no one advice or no one treatment which is good for everybody. Every individual is different. The intensity of diabetes itself is different. The circumstances of the individual are different. So it's the physician which is going to decide, keeping in view the patient's condition and his socio-economic status as well, his occupation as well. For example, we're not going to prescribe insulin to those who are driving.
Right.
So it depends for everybody. So different people may need different type of treatment regimens, but as you have asked about insulins, usually insulin we give to those patients who are not well controlled on other medications. Insulin is a very good treatment for diabetes mellitus. There are myths about insulin. People say that it is the last resort treatment. It is not the last resort treatment. It is something natural for the body. Our bodies do produce insulin normally right from our childhood or even pre-birth time. Our bodies produce insulin.
Exactly.
And this insulin is nothing extraordinary for our bodies. This is part of our body. And if someone needs insulin and the physician decides that the patient needs to take those insulin injections, then the person should not be reluctant in using it.
Okay. What is diabetic ketoacidosis? They said, while fasting, if somebody has this, it does lead to DKA and it's a very fatal condition. How do you diagnose it? When do you know that you're going into this ketoacidotic state?
Yes, ketoacidosis is something which, although not exclusively, but usually occurs in type 1 diabetes mellitus. And this is a state when there is absolute deficiency of insulin. The patient, type 1 diabetes, because they are usually unaware at the time of diagnosis, so they attribute their ill health to other factors and not to diabetes. And the diabetes remains undiscovered. And as there is absolute deficiency of insulin, then they go into a state which is called ketoacidosis. There is a scientific explanation of all this, but I think our audience are not doctors.
What are the symptoms that one should be very careful
usually
of?
Symptoms are drowsiness, vomiting, rapid breathing, which we call acidotic breathing, poor conscious level. Usually patients develop this marked weight loss, dehydration. Usually patients develop this ketoacidosis, young children or adults, and they develop and they rapidly deteriorate and usually end up in some hospital emergency, and there it is diagnosed that they are having type 1
Now we have a
diabetes.
lot of glucose-lowering drugs that are given to type 2 diabetics, metformin, glucophage, and so many others, right? All the difficult names that we had studied back in medical college. And especially nowadays, what is circulating most are those SGLP inhibitors, right?
SGLT2 inhibitors.
Yeah, which people are using for weight loss now, and especially that injection that is going viral all over. It has become, and everybody and anybody who is not even obese, not even close to being overweight is also using it, depriving the true diabetics of it. So can you please speak about these glucose-lowering drugs, how important they are, which ones are the options, which are the safe options? Should only diabetics take it, or are all these people who are taking it? Please shed light on this.
The question which you have asked actually uncovers a very sad reality of our society, that every drug is available to everybody.
Unfortunately, yes.
So we can get it over the counter. And
in fact, through vendors now.
Through
it's,
vendors, yes.
Online also
and
it's available.
All these medications should be prescription-only medication.
Exactly.
And worldwide, in many countries, they are prescription-only. So as far as different types are concerned, yes, there are certain drugs which are used for weight loss. Some people use metformin for other reasons. For example, in PCOS,
Yeah, that
it
is
can be
okay.
used.
That is
It's a medical
yeah.
use. But all these uses have to be directed by a competent physician.
Right.
Uh, no person should prescribe himself a medication which he is not authorized to do, because it can be very dangerous.
And they're self-medicating.
Yes,
also.
self-medicate. If self-medication is done, it can be very dangerous. Sometimes people can harm themselves very badly. So there are medications for weight loss as well. There are it's a new injectable medication, GLP-1 agonists,
Right.
which are authorized to be used for weight loss, but again by a competent physician, not by everybody.
No, but if somebody who is not as overweight, they just want it for cosmetic reasons, as it is being prescribed by
I think-
aestheticians nowadays, can you please tell them the harmful effects it can
Yes,
cause?
they
And
can.
if they can
They
have
can.
pancreatitis and gastric ileus and all those things which can actually damage and harm them.
Yes, just using these medication for cosmetic purposes can be very dangerous. Some of these medications have side effects like development of depression.
Right.
So development of depression, severe weight loss. People can get complications which you mentioned, like
Yeah.
pancreatitis.
Right.
So these are the things which a person puts himself
At
at risk of and by using themselves. So we have certain algorithms, criterias on the basis of which we will give these medications to specific people
Yeah, after a
or
BMI
for specific
analysis.
indication,
Yes.
for specific indications. So it is not to be used by everybody, and especially not for cosmetic purposes.
Exactly. Now, talking about the complications of diabetes that most of us miss, and only when it is, after we have a complication, that is when we end up with the doctor, and then we diagnose, oh, now we have diabetes, and then we have this thing in our mind that for how long should we take the medicine, instead of realizing that it's a lifelong care now to be doing it, and we forget that all these amputations that we are having, and the eye problems, and everything, in fact, linked to diabetes, the kidney issues, the heart issues. So could you please shed light on all of these complications, how important it is to keep screening for diabetes and to keep checking for all of these?
There are several stages a patient passes through in
Right.
Pakistan when he develops diabetes mellitus. Number one, there is a stage of negligence of health, which is common to us all. We are not exercising, we are eating badly, and then we are negligent of our routine medical checkups. We don't go for them. So we will only check ourselves when there is some problem. And then the second stage is denial.
Yeah.
People are diagnosed with diabetes mellitus, they come to us, and then they deny that they have diabetes.
They don't want to.
So they try to avoid medication, they try to avoid treatment. And the third is misinformation. They go to YouTube, they go to Facebook, they listen to videos,
any
and then
random ones.
those videos tell them that this is all a big conspiracy from pharmaceutical industry.
Yes,
This
they've
medicine is
lowered
all
the
about
values
yes,
and
yes,
yes.
yes. And then they stop taking medications, or they don't. And then they go to hakims.
Yes.
They go to other
Quacks
people,
also.
quacks, and they also give them false hopes that we will give you a medication for 3 months and your diabetes is gone for good
Yes.
for life. So I think these all myths should be allayed, and the people should be educated that they should not deny having diabetes. They should not let them succumb to misinformation, and they should not go to quacks.
And please, with these quacks, I remembered one thing, that people who are suffering from diabetes, if they have a complication, for example, if they're having blurry vision, headache, if they're actually having some renal issues, or even neuropathy and gangrene, they go to these quacks, and the quacks give them steroid injections, which can prove lethal for somebody already having a diabetes. So can you please tell people that everything and anything cannot be cured with Decadron and Delta-Cortil all the time, because it gives them this instant energy boost, and they think that doctor is the best and everybody else is.
I think we don't know what they are using, because
They
they are using multiple things, and God knows what they prescribe to those patients. But main thing is that for diabetes mellitus, there is still no cure. There are certain types of diabetes, which I will get the opportunity, which can be cured by some surgeries, bariatric surgeries. There is a reversal of diabetes which can occur with bariatric surgery, but that too in early stages.
Right.
Otherwise, there is no medication which can cure diabetes mellitus. Diabetes mellitus is something for which we have to use medication for life, or we have to adopt lifestyle measures throughout our life. So this needs to be understood. I think if there is some medication which will cure diabetes mellitus, the person will get a Nobel Prize. and till that time we.
But you know what? The problem is they're complicating the complications with steroids. Because if you can tell them that how it affects the eyes, how it affects the heart, how it affects the kidneys, and especially when they start having these numbness in the legs, in the feet, and then they keep, because they can't feel anything, they keep getting hurt. And when they keep getting hurt, then the wound doesn't heal, and then gangrene, and then amputation. And for these, they go and they get steroids instead of getting their sugar controlled. If you can shed light on this and how early on it is important to keep going for these screenings of your eyes and of your heart and of your kidneys and of your feet.
Yes, steroids actually cause increased glucose levels.
Yeah.
They are not going to treat hyperglycemia or diabetes. They are actually going to worsen it. One thing is this. Secondly, you have mentioned a very important complication of diabetes, that is diabetic foot.
Yeah.
With progression in diabetes, with prolonged diagnosis of diabetes, people do get their feet becoming very numb, insensitive to pain, and they can injure them very easily. The wound healing is not proper, and the blood supply to the foot is not good, and all these factors combine together in development of gangrene, which you mentioned. And ultimately patients can end up having limb loss, amputations, and this can devastate their life, the life of actually families, because I have seen daily wagers who
dependent on their hands and their feet, and
dependent upon their manual work, and they lose limbs, and a whole family loses hope in this way. So taking care
and losing the eyes as well, blindness.
Yes, and there is another factor which is very important and for which we, the healthcare providers, are responsible, that when a patient comes to us, we are only concerned with prescribing medication to them. It's duty of physicians to manage their patients holistically. Giving them medication is not enough. We should educate them, or at least if we cannot spend much time educating them, we should either arrange for an educator in our clinics, or we should give them some written material, at least to those people who can read, some written material, and they can read those things. And nowadays it is easier even to give them or refer them to some videos. So those things can be shared, educational videos, and people can learn that how to take care of their medication, how to avoid complications, how to take care of their feet, what type of footwear which we should use, and what are the early warning signs which we should identify and consult our physicians for in case we develop them.
Exactly. So these diabetic clinics that are set up all across the country now, do you advise how often should a patient of full-blown diabetes who's already on drugs go to these clinics? And if their if the diabetes comes uncontrolled all the time, please tell them how important it is to change the dosage and monitor and see what is going wrong. Because they keep taking the same drug forever.
Yes. This is to be done by the physician, not the patient. First thing is that not by the patient himself. Secondly, on part of physicians, there is a thing which is called treatment inertia. Many of the physicians will not change the doses even when they find out that the controls are not good. So it is the physicians which need to be educated that they should come out of this management inertia, and they should take proactive, quick decisions. They should change medication if the patient is not well controlled. And secondly, as far as the patient's frequency of visits to his or her physician or health facility is concerned, it all depends on how good the control is. If the patient is well controlled, we can sometimes tell them to come after 6 months or even a year. But for those who are not well controlled, a more frequent visit to the healthcare facility is advisable. And when they become well controlled, then even going after 3 to 6 months is good enough.
And when we see that diabetics are the ones that suffer more heart problems, more heart attacks, and more kidney damage and renal failures, and even during COVID, it was said again and again, the diabetics are the ones who are going to, it's going to prove more fatal for them. So what are the things that they need to keep in mind regarding their heart and the kidney health as well?
Yes, a heart disease, ischemic heart disease, stroke, kidney failure, limb loss, vision loss, these are the main big complications which can occur due to diabetes mellitus. And for them, two things are important. One is screening for early signs of these complications, and secondly, the prophylactic treatments. For example, in case of prevention of kidney disease, we use certain types of medication. We control the blood pressure very well. For heart disease, we give them lipid-lowering drugs, the cholesterol-lowering drugs, and these drugs can reduce the risk of development of heart disease or stroke, and avoiding other factors which can combine with diabetes and increase the risk of development of ischemic heart disease. And these factors are smoking, poor physical activity, bad eating. So all these things need to be checked by a physician who is managing the patient's diabetes, and all these things
Now
should
that
be.
summer is coming, we'll be having mangoes and everybody's going to eat a lot of mangoes. And we generally also tend to eat a lot of carbs. Like, for example, we have roti, paratha, rice is the major part of our diet. We think if we don't have carb, we're not full. Right? What is an ideal diet for a diabetic? What are the things they should avoid? What are the things they should eat? And in how much moderation? What are the things you should opt for?
Carbohydrates are necessary for our body, but we suggest to our patients that instead of consuming refined carbohydrates like sugars or cakes and biscuits and
Puffs, pastries.
puff pastries and sugary drinks,
Yes.
we should go for complex carbohydrates like a whole wheat
Oatmeal.
whole wheat roti or whole wheat
Okay,
paratha or
yes.
whatever you want to consume. Secondly, we should go for a variety of
Balanced
sources of carbohydrates, as you mentioned, that oats and barley and other different things as well. Thirdly, we should add up vegetables to our food. Fourthly, we should go for more of rather increased portion of proteins in our diet, going for low-fat dairy,
Meat,
low-fat dairy, low-fat meat, seafood. So, although it is difficult to afford in Pakistan, and saying this on television to the public, it becomes sometimes very difficult. But making healthy choices, even from the things which we can afford, is good. For example, pulses.
Exactly.
So they are good for diabetics, and then we should really decrease on our fat intake, especially the saturated fat.
Right.
Saturated fat,
The ghees and everything.
ghee, yes, saturated fat. So this ghee is bad. Bakery products are very bad, because these bakery products and
Then processed
this
meats.
packaged food, they usually use saturated fats in them.
Yes.
So we should avoid these things.
So if we go to a very cleaner lifestyle like our elders used to back in the day, organic and very pure from our own soil, you know, coming out all those fruits and vegetables, and using the pulses and the whole wheat grain before they take it to somebody to refine. So anything out of a packet is going to be basically dangerous for us.
Yes,
right?
it is going
Okay,
to
when
be.
we talk about metabolic syndrome, because you know, as a dermatologist, a lot of people come with darkening of their a neck and a protruding belly, and they start are saying, oh, this belly is dark, so we need something for it. But actually, the underlying problem is the insulin resistance. So, what medication would you prescribe, or what kind of advice would you give to somebody with metabolic syndrome, where they have a very big protruding belly and they have a host of other issues, raised cholesterol, raised TGL, all of that, as well as these darkening of their areas?
I will surely not prescribe any medicine in general, but what I would suggest is doing exercise.
Yeah.
Secondly, I would suggest that there is a role of nutritionists, dietitians in our society, which is very much underestimated. These are the people who should educate our masses, and the people should actually consult them.
Right.
And actually, we need a new diet for our country. A new Pakistani diet, which is rich in good things and low in bad ones. So the traditional diet which we have been eating since our childhood was the diet which our elders were eating while they were working in the fields.
Had lot of physical activity.
With lot of physical activity. But we have lost that ability of doing physical activity, that chance of doing physical activity. But we have continued with that diet.
Right.
So this is the bad part, and that is basically the reason of this huge epidemic of diabetes, which is engulfing our country.
Exactly.
We are number one in the world in diabetes mellitus.
And a lot of people are exploiting it as well. There are a few quack doctors out there who are now claiming that stem cells or PRP into the pancreatic islet cells, and they're injecting, and they're saying and they're charging people like 30 lakhs and saying your diabetes will be cured. Can you please tell them to stay away from such quacks, or if there is any truth to this?
People are trying to find out ways of injecting beta cells
Yes.
into the pancreas. and there are certain scientific, I would say, programs in which beta cell transplant is being considered, and it has been done specifically in some areas, but it is not done by injecting it into our brain.
Exactly.
So whatever these people are doing, it is unproven.
Yes.
And no,
Because
without
people invest, they sell their houses, they go and they're getting that injection done, and they're like, oh, this is going to cure our diabetes forever.
it is because those people who are doing it, they have
Convince them.
they can convince them. They have a knack of marketing.
Good
They are good marketers.
hypnotherapy.
So they are good
Yeah.
marketers, and they market it to the people, to the desperate people, I must say. But there is still nothing proven in this sense. And pancreatic transplant is there, which is a reality, but it's an operative procedure.
So now that the season is here and we have spring is here, there are a lot of allergies as well. We'll shift from diabetes now to a little bit of allergy, because since you are an internal medicine specialist. So could you talk a little bit about all these allergies that are so prevalent these days? How should people avoid it? The recurrent flu that everybody is having, it's not being cured at all. Just a little bit on that so that we can touch a few topics.
Like diabetes mellitus, allergies are also on the rise worldwide.
Yeah.
And the factors behind this rise in allergy is still not very well understood, but probably there is some role of artificial chemicals which are there in our food, and exposure to so much chemical in the form of pesticides which are added to our food, in the form of different types of cosmetics, soaps, shampoos which are using on our skin. So all these things are probably having their role in development of allergies. So these are all chemicals which our bodies were not used to previously, and now our body is exposed to them. But allergies are on the rise, this is a fact. Currently it is spring season, and in spring there is a lot of pollen there in the atmosphere. Especially in Islamabad, we are living. This is paper mulberry, which is known to cause allergies, and there is a drive by the government. I have heard of it that they are going to eliminate this paper mulberry.
Yeah, but I hope they put other trees in its place, because then we won't have oxygen to breathe as well.
Yes, local trees.
Yeah, so allergy is still better than no oxygen.
Yes.
And a housing society in its place.
Yes. So these allergies are a reality, and for those allergies, yes, of course, we need to avoid it. Another cause of allergies is this smog and pollution outside, which when we go out, and this dust.
And we have less trees that are purifying our air now, because we have more and more concrete and all of that as well. So what do you tell them, how should they deal with allergy? One is avoidance, and the other is antihistamines, long-term antihistamines like Montelukast and all of them. First they said you should be taking them, now they're saying you should not be taking them. Some say you should be taking allergy vaccines, and a little exposure to the allergen, it might make you better. So what exactly is the solution for people suffering from these lifelong allergies?
Again, I would say that giving a solution to everybody which works for everybody is not, it cannot be given in a program. So people will have their personalized solutions when they will go to some allergy specialist. Going for vaccination regarding allergies is a good idea for those who are having it chronically and not relieved by the relieving measures or antihistamines or Montelukast, whatever. But the success rate again is not very great, and 1/4 or 1/3 of the people will get some benefit. The rest of them will not have.
And what about these recurrent flus? Why is our immunity so low? Should we be taking flu vaccination? And nowadays people, even other healthy people, in the past we were all healthy, we are having repeated flus. It's not just winter season or just one season. Okay, even in peak summer people are having flu. So what is the reason for this repeated flu?
The reason for this is actually the transformation in the world, which is more intermingling of population. Previously it was one village, the people will remain there. A visitor to that village will come once in a fortnight. Yeah. But now in every other day we are meeting people who are coming from different countries, different cities. So we are intermingling with each other more often. So we are carrying viruses from one part of the world to another part very, very frequently. So this is one of the reasons we are getting an exposure to multiple viruses in one season.
And should they be taking flu vaccine?
Flu vaccine is a very good idea because, and I must tell you, because flu vaccine is one of the main factors behind longevity. Okay. There was a study which was done, and among the top factors which contributed to longevity, one was taking flu vaccines. because especially the elderly and those with chronic diseases, if they receive flu vaccine, they are less likely to die early as compared to those who have not received.
And what are the ways to actually boost your immunity? Do all these vitamin supplements, vitamin C, all of that, does it really help? Or should we be taking a diet so rich in vitamins, multivitamins and nutrients that it should help? And the exercise, what is the role, how to build your immunity or boost your immunity?
Immunity boosting is something to do with a good lifestyle. Having adequate sleep,
Sleep at night.
taking a good diet, doing physical activity, keeping away from restlessness and mental stress. All these things, all these factors contribute to in boosting of immunity. There is no specific drug which can boost immunity in itself, but if somebody is deficient in a particular type of vitamin, then yes, taking that vitamin would help. For example, if some people are deficient in vitamin D, then taking vitamin D would help him. But for those who are not deficient in vitamin D and they are taking multiple types of
so vitamin C
multivitamins.
helps, vitamin D helps.
Yes, these
What
are
is the role of this vitamin A in measles? Because there's a recent outbreak of measles.
Yes, in
especially
measles, vitamin A can help. Yes.
Okay.
It can help in reducing the severity and reducing the transmissibility of.
And they're saying that measles has an international outbreak right now in places like USA, which were before they were free of all this, have that along with the many new things that USA has developed. They have also developed measles. So what are the ways to stay away from it? The vaccine, or is it like once you discover a child has it, how do you take care of it?
The most important thing is vaccination of the children, because
MMR?
Yes, it's the children who are going to suffer the most.
Right.
And getting a measles shot at 9 months and 16 months, as is there in our EPI program, it is the responsibility of the parents to get their children vaccinated against measles. And this is the most important factor. And whenever there is an epidemic, usually the government starts a measles vaccination drive, and as responsible citizens, we should participate with our children in that drive.
Exactly. All right, Dr. Saab, could you tell us a little bit about your own self? Why did you choose internal medicine? How satisfying it is? Where did you study from? Where have you been working all these years? And what are the kind of patients that you're seeing maximum? What is the difference in the kind of diseases in patients? And what is your advice to everybody as an internal medicine specialist? A little intro about your own self.
Yes, I have been studying. I studied in Army Medical College. Initially, I served in Army for a few years. And then after I was relieved from Army, I did my post-graduation. Choosing internal medicine is because I think it's a field which is very holistic. It deals with almost everything.
Everything, yes.
And it keeps you in touch with everything. It is the field which leads all the medical sciences,
Exactly.
internal medicine. So that's what was my motivation of not moving out of internal medicine into even into some subspecialty, because I wanted to remain more general in my practice. The type of patients which you have asked is a very good question, because I think there are certain type of patients which we are seeing and are training for different disciplines of medical disciplines. One thing very important should be psychological illness. What I'm seeing in my practice nowadays is that there is a huge burden of psychological illness. Many patients who present to us for different physical problems actually have psychological issues. Depression, anxiety, these are so prevalent and so underdiagnosed, so undermanaged, that and the reason behind is lack of training in these disciplines while we are studying internal medicine or dermatology or other
else.
things.
We just focus on the outside now.
Outside,
We don't
yes.
focus on the inside.
So it is psychological, it is psychiatry which helps us understand person as a whole.
Exactly.
And not a person as a disease, as a diagnosis. So we should manage patients, our people whom we are seeing as a human being, as a holistic personality, and we should cater for their psychological needs as well. So my request would be that trainings in any discipline, even orthopedics or surgery, should include a portion of psychiatry in it.
That is such a good idea, and it is such a good advice. And as you heard Dr. Saab, what he said is mental health is equally important with physical health. So it's not only taking care of your physical health and identifying your symptoms and or everything, but changing your lifestyle for the better with exercise, with diet, with abstinence from things that are going to actually damage you, whether it is drugs or smoking or overuse of social media, and most importantly a positive outlook in life, less of negativity, more discipline, more manners, more
Yes.
more of time management, what you do with your time and how good you are at heart and how good you're going to be communicating with other people, and that is what is going to actually help us. Thank you so much for such valuable time, doctor. It was very nice to meet you, and you almost summed up the entire Davidson in one episode. And thank you so much for watching, and I hope all of you out there who suffer from these symptoms recognize their symptoms and correct yourself before it's too late. Thank you very much. Allah Hafiz.